I am Louisa Conroy. If my name is familiar, I am the aunt of the baseball and football guys from the high school and middle school. So I do have family here in town. I got here by way of North Carolina. I moved on Saturday from my little mountain village of Hendersonville in North Carolina, and I'm very happy to be here with you all, and am happy to bring my passion in life, which is integrative medicine. Kind of a little bit about how I wound up in this integrative medicine, talk about what it is. I did a first tour in Memphis at Rhodes in undergrad, and I left there thinking that I wanted to be a priest. Well, long story short, that didn't happen. It took me about 9 years from college to decide that I wanted to go back to my childhood passion of being a doctor. And I always knew that, sorry?
I can't hear you very well back here.
Is that better? So I went to medical school at the age of 30. And back in Memphis, did another tour in Memphis. And I got into medicine, and in medical school you learn the idealized form, at least you hope you do. And then residency hits, and that's when I ended up in North Carolina in the mountains to do a rural family medicine residency. And basically, by the time I got to my second year of residency, I was despondent. I didn't want to do medicine anymore. It was not what I wanted. Patients were unhappy with the care they were getting because you wait to see someone for 7 minutes, and the doctors are forced into rushing through patients, to rushing to procedure-heavy, diagnostic-heavy treatment. So I, by the grace of God, found a rotation at University of Arizona Center for Integrative Medicine, and got to find out about integrative medicine. And this saved my career, certainly. And I ended up getting to spend a month in Arizona surrounded by ideal medicine, what I wanted back when I decided that this was what I wanted to do with my life. So now that I graduated from residency, and then I did a 2-year fellowship at the University of Arizona in integrative medicine. And now I get to be here with you all, and I think I'm the first integrative medicine doctor in the region. So I'm very excited to bring this new, old way of medicine to you all, and it's even better that I get to be near my family. So, if I were to ask the 47 of you all who are here in this room, what is integrative medicine, I would probably get about 45 different answers. You probably have some idea, some preconception of pieces of it. So I'm here to hopefully give a clear picture of what I do and how I do it, and clear up some ideas that you might have. So, what is integrative medicine? So, this is a definition that is not mine. It's like our credo almost from the University of Arizona. And it was developed by, I'm sure, a committee, and it took many years. And it's a heavy, dense definition. So I'm just going to work through that, and that'll probably give a better idea. So I'm sure you all have heard of Dr. Andrew Weil. He was the one who founded the program from which I graduated. And he originally was practicing what he called preventive and natural medicine. So that was kind of his 3-word what he did. And he eventually, if not developed, popularized the term of integrative medicine. So, some of you might be thinking, and I've heard some people will call it, when they hear what I do, they'll say, oh, it's holistic medicine or alternative medicine or complementary medicine. And all of these kind of have some element of negative connotations, or they push buttons. And alternative is kind of my least favorite, because that implies that there are only two choices. There's the good choice and the alternative. And that's not what we're doing here. We're really trying, it's more of an eclectic medicine to bring the best of all worlds for the best care of the patient. So it's really a healing-oriented medicine. It's a philosophy of healing, which I want to clarify the difference between healing and cure. Because I think a lot of times, like if you go to the doctor, if you want something to be given to you to cure, for instance, if you have hypertension, then you can go to the doctor, you get a lisinopril or amlodipine, and it lowers your blood pressure. But did it address why you had hypertension in the first place? How's your diet? How's your sleep? How's your stress level? Are any of those things talked about? And so that's where healing comes in. Now, healing doesn't always mean cure. If you have a terminal diagnosis, you're not going to cure that. You're not going to get rid of that. But you can heal how you see it, how you approach it, and what your quality of life really is there towards the end. So we do, back to concentrating on healing-oriented medicine, we're going to have a preference towards non-invasive therapies and therapeutic lifestyle changes that enhance the body's innate ability to heal. The body wants to heal itself. If you get a cut, what do? You clean it. If it's not a deep cut, you need stitches. You clean it, hopefully. You might put some antibiotics on it. You put a bandage on it, and your body heals that cut. There's nothing you can do to make it better. You just have to give it the right environment and stop hindering it and give it the right, what it needs to heal. And that's kind of how we try to think of everything that might ail you. Let's see, sorry. So it takes account of the whole person, and this is where we get into the holistic. Sometimes we'll hear people talking about holistic medicine. So we really want to take into account everything that makes a person a person. I mean, we're more than just a body. We're other dimensions of life. There's minds, emotions, spirits, we're community members, we're family members, and all of these things can play a part, and certainly do play a part, in a person's health or disease. These other dimensions, if we need to intervene, we need to know what those are in order to help. And so third, integrative medicine insists that all aspects of lifestyle are considered to understand kind of the equation between health and illness. Particularly if the emphasis is going to be on health maintenance and prevention, then we want to start with the things that involve lifestyle, nutrition, diet, exercise, sleep, stress management, toxin exposure. These things are important to create the supportive milieu that will enable that innate capacity to heal. So this kind of is where we get into, who is involved. And you can see that this would lend itself towards chronic conditions, like things that really need multiple channels to really address, prevention or disease. We emphasize this sacred relationship between the practitioner and patient. This is something that I kind of mentioned, like how I wound up here from residency, that, you know, we have people who have never been a practitioner dictating to the practitioner what the relationship, how much time is involved with a patient, and sometimes even what you can or cannot do. So it's really hard in that, you know, 5 to 7 minutes that you have to develop the kind of therapeutic relationship that really will foster healing. And then finally we get to what most people probably believe is that, and it's informed by evidence. This is very important, particularly if there's any other health professionals in the crowd, that just because something is old or natural does not mean that it's harmless and useful. So we want to use the best of evidence-based medicine from all aspects. And then we make use of all appropriate therapies. So this is where we get into the using ancient traditions, using herbs, using movement, using lifestyle that can affect health or disease. So I hope that that's clarified that it's not synonymous with alternative or complementary medicine. I mean, that's a part of it and an important part of it. But the integrative medicine movement has much larger goals that are relative to the health crisis we face today. And I think we all can agree that what we're doing is not cutting it anymore. Moving on, kind of a little bit more definition. So the defining principles of integrative medicine. This is kind of like our 10 Commandments, or 8 Commandments. So again, touching on that the patient and practitioners are partners. And this is indeed a sacred encounter. I mean, there's rituals involved when you go to the doctor, or when the doctor comes to you in the case of home visits or in the nursing home. So, you know, the time that we have with a patient is, in the grand scheme of their life, is minuscule. So you're not going to come to my office and then suddenly I'm going to be in, you know, your hip pocket to watch how you're, you know, how you're eating, even if you're taking your medicine. I mean, how much is compliance a problem with pharmaceuticals? So often when I'm sharing a meal with folks, particularly family, it's like I'm the dietary confessor. You know, my thought, if not my words, are that it's your body. I mean, my job is to teach, to inform, to support, but I can't make you do something, and I don't want to make you do something. That's your decision. So that's where it's that I think we've turned things on our heads with regard to medicine, and that the concentration needs to be on the patient rather than, you know, the doctor enforcing things. So then all factors, this is back to the lifestyle thing, that all factors that influence health, wellness, and disease are taken into consideration, including mind, spirit, community, and then of course the body. Like, all those things are just as important to a person's health as another. You know, I want to address these things before we reach for anything, before even we reach for pharmaceuticals or certainly nutraceuticals, is to make sure all of these are in line first, because otherwise you're not having that supportive environment. And then, you know, appropriate use of conventional and alternative methods facilitates the body's innate healing response. I talked about this a good bit on the last slide. That, you know, we're not going to reject Western medicine at all. That's what our original training, and that's the first thing we want to do. But then we get to this, that effective interventions that are natural and less invasive should be used whenever possible. So that's to say, if you have, for instance, insomnia, and if you have 5 to 7 minutes and you don't have time to talk to your provider, they might say, well, here is a sleeping pill. And what do sleeping pills do? Leave you hungover. They really just make you forget that you had a bad night's sleep. They kind of knock you out. So, much, preference to that is, what if we do things that cost absolutely nothing with no side effects, like working on the environment in which you sleep, your habits before you go to sleep. And you can do mind-body things like progressive muscle relaxation. And then if those don't work, then we can go to like the herbs that might help to let you let go of wakefulness. But all those are steps you can take before you get to those things that damage you in one way or another. So again, we do not reject conventional medicine, and we do not accept alternative therapies blindly. This is where we want good evidence. We want to make sure they're not harmful. I mean, just because something is natural does not mean it's harmless. I mean, digoxin is from a plant. Cocaine is from a plant. So natural doesn't equal harmless. And this is where it's useful to have someone who's trained in being able to know the side effects of things other than drugs. And this is, again, for the providers in the audience, that acknowledging that continuous research is needed, kind of always. I mean, think about how our minds have changed, just in my lifetime on the effects of fat. Fat was evil when I was a child, and now good fats are great, lately we've learned about the health implications of loneliness. That's something we wouldn't have thought about half a century ago. And then, again, back to lifestyle, that alongside the concept of treatment, we want to talk about health promotion and prevention of illness. In a grand scheme of things, this can mean, reducing lights at night and community-wide things, but we also have, individual ways of doing this. And then finally, we get to the principle that's most daunting for me as a provider, because it's that practitioners of integrative medicine should exemplify its principles and commit themselves to self-exploration and self-development. And I think that this makes us sound like we're supposed to be, perfect models, which we're all human. So, thankfully, as a group, I think we're a bit more consistent, and you can see that there's something different. And kind of my favorite story about this is when my colleagues, I worked as a hospitalist while I was doing my fellowship, and had this kind of, very kind of grumpy colleague, and he found out what I was doing, that I was doing integrative medicine. And he had come to the hospital where we worked in North Carolina from a large academic institution that had an integrative medicine department, and that department was housed on a whole floor of a medical office building. And he said, whenever I was going up to my office and the elevator doors opened to the integrative medicine, it was like they were opening into a different world. He said it was pretty, the lighting was nice, it smelled good, and everybody was happy. And so if I can take that and use that as an example of what we're trying to accomplish, of being a different experience, and if everybody could be happy with that, that'd be great. So I hope that I've established that with these, integrative medicine is more than just, adding omega-3s to your diet, or understanding herbs better than most physicians do. But that said, that's probably why most of you all are here. So let's talk about some of those complementary medicine, because that's an ammunition in our arsenal that's not to be missed. So, complementary or alternative medicine are those thoughts and ideas that are not taught in conventional schools of medicine. So, these are not things that I learned at UT Health Science Center. And those range from those that are sensible and worthwhile to those that are foolish, and a few that are downright dangerous. And so the challenge is to sort through all that, from the wheat from the chaff, of what's good and what's dangerous and what's valuable and what's wasteful. So the National Institute of Health has a National Center for Complementary and Alternative Medicine. I don't like that name, but that's what it is. So they fund much of the research for integrative medicine now, because you can imagine there's not much money in investigating the power of broccoli. So they have categorized complementary modalities into 5 categories, and these 5 categories are useful for organizing your thoughts around non-traditional and non-lifestyle approaches, because again, we want to address lifestyle before we get to this point. So the first is biologically based, and these are, it's hard to believe that this is considered alternative, because in a recent survey, 75% of Americans use supplements, 37% use herbs. So that's the majority of folks in this room probably are taking something that's not a medicine, not prescribed by your doctor, and it's just on the shelves, it's on Amazon, wherever, that you can take, and probably wondering what it's doing to you and hoping it's helping. So the biologically based are all the botanicals, the probiotics, the supplements that you put in your mouth. And then we get to the things that are a little bit less mainstream. We have mind-body medicine. And this is where you get into meditation, guided imagery, hypnosis, yoga. And to me, it's incredible that this is considered alternative, because your mind is part of your body. It's literally connected. Using these things to treat things like depression. I mean, most of the pharmaceuticals that are prescribed in this country, does anyone know what the most common one is? Antidepressants. Most common drug prescribed. And so if we could address this with some guided imagery, or hypnosis or movement, that could be relieve some of the burden of side effects and certainly cost in pharmaceuticals. Then we get into manual medicine. This can help a lot with musculoskeletal type things, obviously. And then we get into something that's a little outside my comfort zone, but there's many things in this world I don't understand, and that's energy medicine. I can speak the language. I don't practice it myself, but these kind of things like Reiki and therapeutic touch and aura, there are many things. There's not a lot of research on them. It's not outside the possibility that this is something we'll discover hundreds of years from now. We do EKGs and EEGs all the time, which are based on electricity, so maybe there's something to this. But certainly it does have at least some value, to certain patients, so that's useful, and it's probably not going to harm. And then we get into the whole systems. I'm not an Ayurvedic practitioner. I'm not traditional Chinese medicine. I speak their language a bit. I know what they're talking about. But these systems, these ancient systems, touch on all of these, and are not to be dismissed just because they're not of our culture. And certainly, if that's something that you're interested in, like I say, I would not be able to practice that myself, but I would be able to be in communication with your practitioner. So, I took 30 minutes to get 2 slides. Just quickly, why? Why do integrative medicine? Why come see an integrative medicine practitioner? If any of you all have been in a waiting room, or you've been at a not so happy hour with doctors, you know that the system that we have now is not working. Doctors aren't happy, patients aren't happy, we're not getting enough quality time, and all of those, the relationship is often missing. And you can develop that, but it takes several years. Really what we have now is not healthcare, it's disease management. So what we would like to do is get to the point of, truly have benefiting health and hopefully preventing disease. And then we have the more advanced, new ways, technologically advanced ways to deal with the things that really begin to, once you have a disease or have a broken limb, certainly you need surgery. Really, anger and frustration is just boiling over from all sides. Let me show you a map that will just demonstrate a lot. So this map is total healthcare expenditure by the share of national GDP by country, and this is from 2014. But we're number 1. Yay, we're spending more than anybody. So what are we getting from this money that we're spending? This is healthcare expenditure versus life expectancy. The U.S. is that red line. Spending more than anyone with a life expectancy lower than everyone. What we're doing is not working. So let's change that. It kind of seems obvious that we're spending money in the wrong places. So let's work on promotion of health. Let's work on less technologically advanced ways to include pharmaceuticals. Let's use those when they're necessary, but only when they're necessary. And then I just want to touch on that. Again, this is so disturbing that we need to change our conception of health. That health is not merely the absence of disease. Health is a positive quality. It has to do with the innate quality of resilience that the organism of us has, which enables it to interact with things in the environment that are toxic and harmful and not lose the balance. So it's up to us to learn how to protect and enhance those innate mechanisms of healing. So, when would you come see the Elks with me for an integrative medicine consult? So certainly, for prevention, if you want to come and, you've recently found out that, your brother has early colon cancer, or you have a strong family history of heart disease. What can you do to prevent that? Or if there's nothing like that, just how can you optimize, your health now? And then certainly, when it comes to treatment, like if you have a diagnosis of, anything from hypertension to cardiac disease, to even some types of cancers, there are things we can do to help support that healing, if not curing, hopefully curing. And then who's involved? So of course, patients, we've discussed how important those are. And then I just want to kind of talk about practitioners. That integrative medicine, we need to tighten up who we say does integrative medicine. And it's kind of gotten thrown around that kind of anyone who is interested in this kind of thing or just wants to do something different or even does cosmetic Botox injections call themselves integrative. Having spent the last 3 years of my life dedicated to studying and studying for boards, I kind of resent that. And so there are, from my program that at the University of Arizona, over the last 20 years, they've graduated about 1,800 practitioners. Now, there are other, from the fellowship, there are other centers that have fellowships. I would encourage, if you're thinking that this is something you're interested in, to make sure that your provider is a graduate of one of these, to make sure that they are practicing safe, evidence-based medicine. And how, here in Henry County, you can call Griffith Clinic, where I will be practicing integrative medicine consultation 1 day a week, starting out. If it ends up that everybody in this room wants to see me every month, then I'll change my schedule. But for now, I'm going to start doing consultations one day a week. I will also be doing primary care. And this is kind of difficult because, obviously I can't separate out who I am and how I practice medicine because I have less time. However, that is a reality that I won't be able to learn everything about you in the 20 minutes that I have for a primary care visit. So we can work on that relationship, of course, as we go on about things. But if you have a primary doctor that you love, a cardiologist or nephrologist or whomever, and you just want to, have someone look at those supplements you're taking and tell what those interactions might be, or talk about energy medicine, or then that's what a consultation is for. Now, consultation, I would like to do a fun consultation for about just 10 minutes, just to make sure that I'm what you want, I'm your expectation, and that there's something I can do to help. It's not going to be, a waste of time and money and a disappointment. And then the first visit will be approximately 90 minutes long. We'll really get into things, and then come back. We'll talk about therapies, and then after that, we can, talk about maintenance and add-ons.